Curcuma Longa, turmeric, Indian yellow curry spice. We call it haldi, haridra. It's a ginger family. If you go back, it looks like a ginger, except when you cut it. It is extremely red. Not red, yellow almost to the dark reddish color in it. Pretty much every single Indian cooking involves haldi, turmeric. And we use the root only. It's very common practice. If you got accidental trauma, you hit your toe, you bumped into something, you fell off something. First thing my grandpa would do would be, okay, grind the haldi right now. Just grind up the haldi, grind the turmeric, warm up the milk. Here's a teaspoon of it. It's right now. Before he even cleaned the wound, he wanted me to take haldi and milk warmed up. And I will talk about why the milk isn't necessary to do it or any other things that are necessary to do it. It was amazing what it worked for us. It also has a good role in digestion, circulation, and respiratory tissues. It has a strong anti-inflammatory powers, even more potent than phenylbutazone, old-fashioned NSAID, and corticosteroids. It's excellent hepatoprotective product for liver problems. You can use it. It's a free radical scavenger and has excellent anti-cancer agent. A lot of oncologists are recommending to use it. It also helps to reduce the side effect of chemotherapy. Similar pathway as boswellia was reducing inflammation through those two pathways. We talked about cyclooxygenase, chemotactic pathways versus lipoxygenase. It's used in IBD, inflammatory bowel disease, liver problem, arthritis, respiratory disease, and inflammatory conditions. Can be mixed with the food or home cooking. It is known fact that the curcumin or turmeric does not get absorbed properly if you don't have a oil source, a lipid source, or fat source. That's the reason they warmed up the milk, because it has a fat in it to take it with it. But people now are saying that you can use the ghee, which is the butter, clarified butter heated up, any other oil, along with the piper longum, which is like a black pepper, but it's a little longer. And you crush it, it helps to help better absorption of curcumin. Turmeric. Curcumin is an active alkaloid, very potent product. A lot of people are selling it. And I always tell people, be careful. The product you buy is bioavailable. Since my family is a business manufacturing too, and we see what curcumin could be, nothing from yellow pigmented corn flour to a curcumin, you want to make sure it has the potential activities. It's used for nervous system healing, effective in spinal trauma, intravertebral disc disease. Lisa here, sitting a good colleague from Seattle, probably knows our Dr. Sean Sanders, a neurosurgeon and neurologist. His go-to was curcumin for all the intravertebral disc disease. He's a neurosurgeon, and he found benefit in using nutraceuticals, including curcumin, helping with the spinal traumas, intravertebral disc disease after he's done surgery. Can you go home with the omegas? Can you go home with the curcumin? And I kind of kindly joked with him and say, if you start to be a holistic doctor, I will be in trouble because you're not only a neurosurgeon, you'll be taking away my clients from me. He says, no, Dr. Sodhi, I learned from you or from your guys. And I said, okay, that's a compliment. I'll take it anytime. But excellent. Try it for your doxies, or dogs who have come out of spinal surgeries and you need to heal. They will use it. They will have a good thing. And again, I think it's another segue I want to transition into it, because a lot of these spinal dogs, disc dogs, are on prednisone or anti-inflammatory non-steroidal. There's a whole thought process goes on it. You don't want to combine curcumin with steroids, because curcumin is known to have an antiplatelet activity. That means it helps to promote bleeding or does not allow the clotting to happen. People come on, but there was a thing about you don't want to do steroids with the curcumin. You don't want to do NSAIDs with the curcumin. I never had an issue. There are a couple studies out there, but then it's easily remove from my mind by the fact that I've done it for so long. I've never seen a dog with a bloody diarrhea or GI ulceration of melena. Have you seen anything, Elisa? So I think be prepared to answer those questions. If you have any questions or you cannot answer, reach out, ask. I'll be more than happy to. But I want to make sure that people do understand, though it has an antiplatelet activity, it does not promote GI bleeds, does not promote GI ulcers. Rather than it's a very strong protective of the GI ulcers. Again, the doses, what I have here is based on, it's written there, and it could do a lot higher than that.